Well, I think we should probably go ahead and get started. I see we have about 62 in the room, the virtual room. Welcome, everybody. Good morning to our, I guess, uh, um, second round and second town hall of the second round, just to try to keep people informed and answer questions about the state of the institution, where we're moving, primarily with regard to the COVID pandemic, how things have changed, what the fall is looking like, those sorts of things. So I'm going to provide you, I guess, with a little bit of background, and then be happy to take questions as we move forward. Just dropped out of a meeting with the Council of Deans where there was a very extensive discussion on what things were looking like for the fall, and so I can provide a little bit of an update on that. Ginny, do you want to just talk about ground rules and how this works to be able to ask questions and things like that as we get started?
Absolutely. So this will be similar to previous town halls. Everybody can submit questions. You will either do it publicly, like you see here in the chat feature, or you can select my name, and that will ensure that your question is anonymous, and I will ask those to Rex. So we are recording this this town hall meeting, and so that will be available later for anybody who missed it. And then we're adding a little bit of a security update. We're going to be locking the meeting at 10 after. So if you know anybody who is unable to get in, we're going to be streaming this to YouTube as well. So if they miss the cutoff, they can hop on our YouTube account and get access it there. And I think that is it for me.
Okay.
Thank you.
Thanks, Ginny. So if you want to ask questions anonymously, you're more than welcome to send those private questions to Ginny. I'll try to keep an eye on the chat. And so if people ask questions to everybody or have comments, I'll try to stay on top of those and answer those questions as we go along as well. I think I'll start with planning for fall semester. You've probably heard, and maybe some of you have been through other town halls up until now, that there's been some discussion as to how we were going to handle fall semester. There's concern about students coming back from Thanksgiving break for a short period of time, but coming back from lots of places and potentially bringing illness back with them. And so many institutions, ISU included, has considered or have considered making fall semester a bit shorter, and ISU has in fact decided to do that. It will start on time, same time as proposed and on the academic calendar. That is starting August 17th. Midterms will be around October 5 through 9. But face-to-face instruction will conclude on the Tuesday before Thanksgiving. The plan would then be to have online final exams November 30 through December 4, with final grades due on December 15, which is that's the due date as it's already been proposed. The plan for those students that, for example, need a live assessment at the end of the semester is that there will be an exception process for that. But I would ask that as we move forward with fall semester, we plan, and if at all possible, we try to do those end of semester live assessments, whether it be a presentation, a speech, or hands-on activities in a lab, that we plan to do those before Thanksgiving, if at all possible. Now, that being said, if we can't, there will be an exception process that is available. The other thing that has come up consistently is what's going to happen with class sizes and that kind of thing. That was the main focus of the meeting that we were just in with some of the other deans and associate deans, as we talked about how we're going to organize our classes given the need for 6-foot physical distancing in the classroom. And so facilities and the registrar's office that works with our rooming issues on campus and the scheduling of our rooms with classes are currently doing an exhaustive inventory of all of the spaces that might be utilized on campus to be able to accommodate the classes that we have, given the fact that the president has indicated repeatedly that we want to be face-to-face or have as much of face-to-face as possible in the fall. So to do that safely and successfully, it's going to require a new plan for the rooms that are to be utilized. That plan will accommodate a 6-foot distancing. And as I said, facilities has been working exhaustively to try to figure that out. As you all know, we have some rooms with fixed seating. We have other rooms with chairs and tables. We have other rooms with desks. And so the configurations of each of those rooms needs to be taken into account to then accommodate this spacing issue. That all being said, what is going to end up happening, given the multitude, and it's about 8 or 9 different ways of delivering courses that will likely occur this fall, we will have significantly reduced numbers of students in each classroom and additional sections added to accommodate those students and additional online options to be able to either be synchronous or asynchronous in many classes. And that's somewhat up to the program, up to the content that needs to be delivered. But if we have to have online courses, and we desire to, live courses, not online. If we desire to have live courses, we're going to need to have more sections and likely have them in different spaces. At present, the only space on campus that can accommodate a class of more than 100 students is the Stevens Performing Arts Center. And that that space is being looked at in terms of being able to use it for the very large courses that we have, particularly at the 100 and 200 level. The issues related to having live instruction are also being focused upon undergraduates and making sure that 100 and 200 level courses are face-to-face as much as possible. Now, that being said, that's not to say we're going to neglect the upper division courses that are the ones that are primarily within our programs, but just from a university-wide policy, there is a focus on creating opportunities for 100 and 200 level courses to be face-to-face, because that's what students have asked for. That's what students have indicated they missed during the spring semester. And it's what students have said they want coming back, to come back or to even start at the university in the fall. So we're going to have more sections of our courses. There are workload implications related to this, although we're not dealing necessarily with more students in a given cohort. We are dealing with more sections, and we need to begin now, as soon as we have the data from facilities and the registrar's office, which should be this week. We need to begin talking with all of our faculty as to what our classes are going to look like in the fall, how we're going to accommodate the need for more physical spacing of those courses, and the impacts that this is going to have on our faculty and the teaching time that's spent in our different curricula. That being said, we know that there are lots of different labs, there are lots of hands-on activities, there are things that can't be done with simulation or online, etc. And there will be a process to approve those courses to make sure that we're able to do the hands-on learning that we need, and that is so important in our healthcare programs. I'm going to pause there. I do have some other things related to reorganization and even some budget stuff, but I'm going to pause there and see if there are any questions that Ginny has received related to sort of the fall semester stuff, either the timeline or the room spacing, sections, etc.
Thanks, Rex. We do have a couple of follow-up questions. The first one is, will we have any accommodation for the extra workload?
So obviously, in this budget environment, we have two pinch points, right? We have the pinch points of having to cut our budgets, and then the pinch point of having now to, in some ways, increase the teaching time, the workload that goes into that. You know, it depends on the course as to whether we're actually doing or interacting with more students. So obviously that's the balance, that's the rub that we need to deal with. From a budgetary perspective, we don't have many options to be able to do that. And so folks are going to need to be flexible. Folks need to wrap their heads around this. There may be opportunities for more graduate teaching. That's a possibility if we can identify the opportunities for that. But I think that we need to be planning the impacts of what I've just been talking about in each of the departments and figuring out what that workload is just as soon as we have more hard data to look at, well, what do our courses look like? What do the sections look like? And what are the real impacts on our workload so that we can articulate what the needs are. I understand that there may be additional work that comes with multiple sections. Obviously, there's more time in the classroom, time in the lab, but we're in a difficult place right now with regard to the budget for us to be able to make that happen. The university is making some investments in teaching technology and spending some one-time money to upgrade different spaces on campus and be able to offer opportunities for more technology in the classroom, which may create some efficiencies. But we need to have a good understanding of the impact of all of this and the technological needs to be able to then really answer that question in terms of, you know, what does it mean to faculty?
Thanks, Rex. Second follow-up question. Meridian is already short 2 classrooms because of construction. Are there things in the works to enable social distancing options for classes in Meridian?
Absolutely, all classes are being considered. As you all probably know, the peak time for classroom use is between 9 and 3, or class start times between 9 and 2. And so we're looking at all options on the schedule to expand the utilization of those classrooms. And you know, we have classroom build outs in Meridian on the construction schedule. And it may be that we can move those forward, although again, the budgetary issues that we're dealing with here are going to significantly impact that kind of construction planning. But we need to look at the class schedule. We need to look at the time of the day. We need to look at all kinds of factors to be able to deliver the curriculum in an efficient way. And I understand the space constraints. It's not going to be business as usual in terms of the time in the classroom, the times of day that we have to be in the classroom. All those things have to be considered at this point in time.
Okay, thanks, Rex. Next question. Is there any sort of institutional protocol for accommodating students who may miss if they acquire COVID-19, or even if they miss class as a precaution? Will this be left up to the faculty/departments on a case-by-case basis?
So that's a great question. We're working on protocols related to COVID infection for faculty, staff, and students. Obviously, we may have, and we have had just in the last week, students infected with COVID. I didn't provide you with an update, but we did have an infection on campus last week in a student. And so we realize that there may be situations where staff, faculty, and students do get infected. There are 4 working groups, one related to instruction, one related to community interactions, one related to employees, and I'm blanking on the 4th one, that are all looking at those kinds of policies and procedures moving forward. And so The answer is yes, you'll be getting some guidance. That guidance will then have to be incorporated into how we're delivering our programs and the syllabi and how we're communicating with students, but also with our coworkers. So there will be protocols for dealing with absenteeism related to COVID. And then the other part of that question was, what do we do if people just aren't comfortable? We need to have options to be able to deliver this coursework online, and we're going to have to come up with some policies for making those accommodations for students that may not be comfortable coming into the lab or the classroom and doing that kind of thing. That being said, one of the things that we've asked all of the programs to do is begin talking with their students about our plans for the fall. And so we'd like to have some ideas of the problems that we may need to anticipate for the fall, like you just brought up, a student that might refuse to come to class because they're concerned about things, so that we can begin planning for how we're going to make that accommodation, given the fact that many of our programs have an almost mandate for students to have hands-on activities and labs as part of their work. As we plan those activities, we need to plan for smaller groups and, again, more physical distancing as needed and as is possible, given the nature of the activities related to the educational effort.
Follow-up question, and I believe you touched on this, but if there's anything else you'd like to add, are we going to allow students to opt out of clinical time?
So I guess the answer is, and Chris Owens is here, and he's been working on some language related to the safety of students doing clinicals, or learners doing clinicals, and the impact that that might have. I think the recognition that if students are refusing, for example, to go out on a rotation for a clinical activity, is that some of this might be able to be made up with simulation, but some of it may not be, and that may impact time to graduation. So what Chris and his group has been working on is, in essence, a notification, a consent form, an agreement, an understanding by the student that there are responsibilities for the student, there are responsibilities that the practice sites need to be doing and upholding, and there are responsibilities of the program to look after the student. Now, that being said, it may not meet every contingency and keep a student on track towards graduation. And so those are the things that we need to be having conversations with and orienting our students to as we move towards fall semester and even over the summer as it relates to clinical placements. So Chris, I don't know, do you want to add anything about the effort that you've been undertaking related to kind of pulling together some common language? Not that every program has to do it exactly the same, but at least pulling together the elements that we need to be talking with the students about.
Yeah, and you covered it already really well, Rex. And these kinds of assumptions of risk, that's what the documents are, they tend to be titled, are all over the country. Everyone is grappling with this exact issue, how you deal with students who want to stay on track, yet may not be able to fulfill all of the accreditation requirements for a professional program. So I am soliciting input from as many sources as possible. I've already received a ton of feedback over the weekend from the initial couple of drafts of documents that have gone out. We're working with general counsel on campus also. So that input continues to come in, trying to figure out all these different contingencies, but also writing into the document such that there are individual programmatic requirements where a one-size-fits-all is not going to work. We're going to need some way to review exceptions and deal with individual cases, utilizing as much as we can simulation, at least insofar as that's practical and possible and allowable by accreditation standards, but also making very clear the idea that delays in graduation are at least possible if you cannot fulfill the requirements for this program for whatever reason that might be.
Thanks, Chris.
Okay, we have a question about events. Is there a minimum size of group where we need to get ISU approval to hold an event? In other words, do we need to ask for permission for a group of 5 or 10 or 15, etc.?
So there is an exception process for the different events. Now, obviously, as we've moved through the stages of the governor's Idaho rebounds plan, the allowable event size, so to speak, has increased. But those stages, at least up until now, and even into stage 4, which starts in another week or so, really relates to the maintenance of several, I guess, baseline criteria that need to be met. And that includes some consideration of physical distancing, the use of facial coverings, covering coughs and sneezes, hand washing, et cetera, et cetera. So if those conditions cannot be met, those are the situations where we have been asking for people to submit a health exception form. The committee that reviews these is also concerned about things like food at events and buffet lines and a variety of other factors that have been associated with spread, likelihood of spread, depending on the type of activity, for example. So the long answer to that question is that as we move forward, we will continue to get additional guidance from our public health colleagues, from the CDC, from the state, to then be able to define what these groups look like. We've gotten lots of questions about how to do research, and we've had people that want to pack groups in a car or a van and be able to take them to different events and do different things. We've had exceptions requested for larger groups and putting them into spaces. Larger groups meaning larger than is currently approved based upon the rebound plan. So it's a moving target every 2 weeks, but if there are questions about that, you certainly can reach out to the DHS office, or you can submit through the health exception process if you have concerns about you know, a given activity and how it's going to be accommodated, particularly if you have the thought that it might be asking for more than what's allowable at the current stage, if that makes sense.
Thanks, Rex. Next question. Are there legal issues that faculty need to be considering as we move forward regarding discussions with students, especially in respect to outreach initiatives, rotations, and assumption of risk?
Well, and Chris, maybe you can join in again here, but Chris has been having conversations with our general counsel's office. And just as an aside, we have hired a new general counsel. That general counsel should be in place by July 31st. He's the associate general counsel at Montana State University. And so I didn't mention this in the previous town hall meeting. I forgot to do so, but we have at least hired a permanent general counsel who will be able to support things at the university. His first name's Blake. I don't recall his last name, but Blake will be joining us in the next month and a half or so. That being said, Joanne Harasi Stacy and Dave Bagley, who's also served as interim general counsel, are assisting with a variety of different things. But Chris has been talking with Joanne specifically about this kind of activity as it relates to the clinical rotations. I think you have a good question about our different outreach activities, where we're going, what we're doing. And I do think that as we're taking students out into the community, not just for clinical rotations or curricular requirements, but for service activities, we should be thinking about and probably developing a process by which we have a good understanding of the disease mitigation measures that need to be present. For example, if we go to a senior center and do health screenings or do different activities out in the community with our students, or even as faculty out in the community. So that's a good question. I don't think that we have that totally worked out in terms of consent process for that, but we need to put that on our radar, and we need to work through that quickly this summer.
Thanks, Rex. Is there any word about whether December graduation will proceed, given that the fall semester will end early?
So I haven't heard a final answer on December graduation. My understanding is that we likely will not have a December graduation, but I will say that I haven't heard a final answer on that at this time.
Okay. Is the DHS providing masks, or KDHS, I'm assuming, providing masks to students, or is that their responsibility?
So that's a good question, and it sort of depends on the context a little bit. The university is looking at procuring face coverings. Face coverings, the plan for faculty and staff is for us to have 2 facial coverings for each faculty and staff member. That way you can wear one, you can have one that's being laundered. There are plans afoot for students to have face coverings as well. Students will be expected to wear face coverings in class and in public areas on campus. And so we're working on the messaging and the educational program that is going to be rolled out with the mandate or the expectation, I should say, to wear facial coverings. And one of the things we've been throwing around, and I think some healthcare institutions have used this slogan as well, is wearing is caring. But really it's wearing a face covering to make sure that we are looking out for one another. As it relates to students being asked to take face coverings out into a clinical rotation or on one of these service activities that we were just talking about, we likely will have to procure a larger supply of face coverings to be able to accommodate these different things, particularly if it's a BYO PPE kind of a situation on a clinical rotation, we're absolutely going to need to incur that expense. Programs need to begin planning for that now. We need to identify and understand the costs associated with that kind of an effort. And we will be coding those expenditures with a special code that Finance and Business Affairs has developed to then hopefully be able to be reimbursed for additional costs that are above and beyond standard operating related to COVID, via federal or state funds that may become available down the road. So we understand that there will be additional costs associated with PPE, and there will be a centralized effort to provide most faculty and students with that stuff and staff. But there may be additional costs to your individual program, and we want to track those, or they may be additional or new costs for your clinical operation. Those are the kinds of things that we want to track and then be able to hopefully be reimbursed for down the road. It's costs that are above and beyond what we've done before that absolutely must be tracked so that we can do that accounting on the back end.
Okay. And Rex, if we have a specific need for clear masks in our discipline, to whom should we make that request?
So those processes are still being worked out a little bit, but there is a warehouse, a storehouse called the Bengal Depot that is run by facilities that will then stockpile and keep much of the PPE that needs to be on campus. We are looking at, in fact, I was talking to Ryan Lindsay and Chris Owens just this morning about the efficacy of face coverings and what type of face coverings are appropriate. In many of our classrooms, we may have students that have accommodations and need to be able to read lips, for example. So a cloth mask may not be appropriate for a lecturer. So a clear face covering may be preferred. We're looking right now at the efficacy of those and how we procure those. but that is going to be something that may be utilized not only in the classroom by lecturers and potentially even by students in labs or other places, but also in forward-facing customer service kinds of situations as well. So we're looking at how to procure that. Right now, it should be a centralized process. You can communicate with Wendy Holder in the purchasing office, and it might be worth putting her name in the, Connie, if you don't mind just putting her name in the chat. Wendy Holder is the one that's working with facilities and with environmental health and safety on the centralized purchase of this kind of equipment. And so I think it makes some sense to be able to communicate with them.
And Rex, switching gears a little bit, understanding that School of Rehab and Communication Sciences was invited to nominate candidates for director and associate dean. Why wasn't the School of Nursing invited to nominate candidates for director and associate dean?
So there was a lot of discussion with that at Administrative Council. Administrative Council had a lot of confidence in Karen Neal's leadership and what she's been doing for the College of Nursing, soon to be the School of Nursing. And the decision was made to make Karen the permanent director of nursing and associate dean. Because we didn't have anyone in that role and don't have anyone currently leading in that same kind of capacity in the College of Rehabilitation and Communication Sciences, we made the decision to do the process differently. And that was supported by both the president and the provost.
Thanks, Rex. All the questions we have at the moment, if you want to go ahead and talk about restructuring.
Yeah, that actually brings up, that last question brings up some of the issues and the updates that I wanted to talk about. As you just heard, Karen Neal has been named the Associate Dean and Director of Nursing for the School of Nursing, and Chris Sanford it has been named the Associate Dean of the School of Rehabilitation and Communication Sciences. And I want to thank both of them for being willing to serve moving forward as we begin the restructure here in just another month or so, official restructure of the College of Health. We're also looking at consolidating the search committees that were formed up last fall for searches in, for the Dean of the Old College of Health Professions and the College of Rehabilitation and Communication Sciences, consolidating those committees a bit and kicking off a search for a Dean of the College of Health. That was approved by the state last Friday. So we will begin the formal process of rolling out that recruitment. Our goal is to have representatives from the previous Dean search committees. It's not going to be a double the size kind of a committee, but it's going to have representatives from those committees because I think the folks were very engaged in that process for each of those colleges last fall and understand that process, understand the job descriptions, although the job description changes a little bit with this new dean, and we will move forward with that process. We also have had several other changes in leadership position. I want to thank Kathleen Kangas. I don't know if she's on today, but Kathleen is retiring at the end of the month, and I want to thank her for her service and all that she's done for the College of Rehabilitation and Communication Sciences. We also have a couple of other transitions in other departments. Barb Gordon is stepping down as chair of Nutrition and Dietetics, and Shar Byington is stepping up into that role. Jackie Freudenthal in Dental Hygiene is retiring this summer, and Ellen Rogo has agreed to serve as the interim chair as we're doing a search in that department as well. Dr. Solbrig, Ron Solbrig, is retiring from University Health, and we have a search going to replace Ron in University Health, and he's been tremendously helpful during this process as we've been dealing with COVID. Fortunately, Ron's going to remain in town, and he'll be available on sort of a consultative basis for COVID-related activities and getting his input as we're running that search. I think those are all the transitions that I'm going to talk about at this point.
Thanks, Rex. We have some follow-up questions about associate dean positions. One is a clarification question. Was Chris Sanford named interim associate dean or the associate dean for the School of Rehabilitation and Communication Sciences?
Because Chris is serving as chair and also as now as associate dean, we named that as an interim, and we did that because we need to take a good look at his workload and what the commitments are over time, but that position was named as an interim.
Okay. And are these associate dean positions interim positions until the new dean of the College of Health arrives?
So a new dean certainly has the ability to restructure their college. As I think I've just answered, Chris Sanford is in an interim dean role. Karen Neal, because she was really serving as dean of the College of Nursing and has been doing the job and doing it well, was named as a permanent. But as you all know, associate deans serve at the pleasure of their dean, and a new dean will have the opportunity after getting here and understanding the lay of the land to set up their own management team. And if changes need to be made, that will be discussed at that time.
Okay. And are the associate dean positions part-time positions?
Well, I think that remains to be seen. I can see Chris Sanford on my screen here. At this point in time, Chris is going to serve as both the chair and as the associate dean in the School of Rehabilitation and Communication Sciences, and I think that's going to be a big job. We don't have a clear understanding of exactly the time commitment of both of those positions. I know Chris is down at least one faculty in audiology, and we've been looking at filling another position in speech language pathology. So there's going to be some teaching that he will likely continue to do. Karen in the College of Nursing is going to be working full-time as an administrator. There are a lot of different projects and programs that are starting up in the college or the School of Nursing moving forward. And it's going to require all of her attention to be able to do that. So the bottom line is, yeah, I think they're pretty darn close to full-time jobs. And these two people, as we transition, will have a lot of responsibility, because we'll be having a dean by committee continuing to run the College of Health. That is Patty Marincic, Chris Owens, and I will be continuing to do some of the other administrative activities related to that college. So I expect that Chris and Karen will be spending a very, very substantial amount of time on administrative activities related to the reorganization and running of these two schools.
Okay. And related, would it be possible to see job descriptions for these positions?
Sure, we have job descriptions for the positions. Just reach out to the division office and we can provide you with them.
Okay. And then back to the getting away from this day-to-day stuff and back to the events questions. So this is a clarifying question for what this person thought they heard about the ISU exception form. So the form is to be used if the size is larger than what is allowed by the state and the event doesn't allow appropriate preventative practice like social distancing, hand washing, masks, etc.
Yeah, I think the other factors that come into that are how you're going to handle food and travel. Those are the other two big factors that come up. So if we have guests coming in from all over the country, for example, or areas where there's very high disease activity, we need to know that, and that needs to be planned for. Food and the delivery of food, the serving of food, also is an area that we need to consider. So Not all of those details are in the governor's rebound plan, for example. Sometimes those details are included in the detailed plan for each stage, so I would encourage you to look for those. But for the most part, the way that that was restated was correct, provided we have the right kinds of accommodations and I guess precautions in place related to travel and the serving of food.
That is all the questions I have to date.
Okay. Let me see if I have some other notes here of things that I wanted to cover. So I can talk a little bit about budget and furloughs. The budget and furlough plan that we outlined going back a month or so has been basically approved. All employees who have a salary, contracted salary of greater than, I think it was $40,000, will have furlough days that they are expected to take. The furlough days begin, the mandatory furlough days begin after July 1 with the new fiscal year. And it's suggested, actually I think it will be required, that half of the furlough days are taken before January 1 and half of the furlough days are taken after January 1. The rationale for that was to make sure that the furlough days are balanced. It's possible that we could be asked for budget cuts again that could impact the second half of the year. It's also possible that things could improve and the furlough days that are currently being asked for on the second half of the year could be rolled back. So we wouldn't want everyone to take all of their furlough days early in the year if they don't have to take them all at the end of the year. So that's why the year is sort of being split. There is a tiered system of furlough days based upon the salary that individuals make, up to a max of greater than $150,000, where those individuals take, I think it's 13 furlough days. So that's the way that process is being rolled out. I believe that every employee will get a letter from HR that will outline the furlough process, and HR is working on getting those letters distributed here in the next week or so, and will obviously be available for other specific questions. Budget. The budgets that we submitted and that have been sort of returned to the academic units are the ones that have been approved. If you have questions about the budget, you can talk with your department chair or dean and Joe Wilcox, and we can get questions answered about sort of where we ended up with the budget. Obviously, we took our budget cuts in several different ways, reducing operational expenditures, losing open lines, those kinds of things. And, you know, there wasn't a one-size-fits-all kind of activity. So if you still have questions about that, we're happy to answer those. I don't know if that prompted any other questions.
Back to the reorg, we have a couple of questions about that. These are two questions that are related. So the question is, why would anyone take on 10 schools or 13 different departments within the College of Health for anything less than $500,000? And the second part of that question is, do we think that we have enough support, both financial and infrastructure based, to support someone to take on that kind of workload?
Well, it certainly is going to be a big job for the College of Health. Obviously, they're going to get support from the divisional office. They're going to get support from their associate deans, and we know that we have great people in place as faculty and as department chairs. So yes, it's a heavy lift. the salaries for those people are maybe in certain settings might be $500,000, but we feel like we can get somebody hired for significantly less than that, although it will be a substantial salary. And we had to, through the whole budget process, plan for that salary for that individual. We have some excellent staff that are available within the division to support that activity, and the offices for both Laura McKnight and Kathleen Kangas have some great staff working in that office that will be able to support this new dean as we move forward with the reorganization. They're a great addition to the sort of central administrative structure of the division. So yeah, I think it is going to be a very, very challenging job. I think that there are some great opportunities, obviously, to be a part of the largest college on campus. And as we look at how we're going to support that person moving forward, I hope that the organizational structure, the role of our office at DHS Central, will be able to make sure that that individual is successful. But you're absolutely right; it's a big job.
Okay, follow-up question: how is it determined if an academic unit has a department chair or a director?
So I have to tell you that I don't exactly know. Sometimes it's an accreditation standard. Sometimes that predates my role as vice president. In some cases, there are chairs that are required based upon accreditation. In other settings, it's a program director. And so it's largely based on accreditation language. And if there are specific questions about why someone's a program director versus a chair, we can certainly address that. Some of the academic units are smaller too, and that leader supports a program perhaps more so than functionally as a chair of a department. But a lot of that is very much historical, and I don't actually know all the decisions that were made over time to create those titles.
Okay. And Rex, can you give us your current title and Chris Owen's current titles?
Sure. My current title is Senior Vice Provost and Vice President for Health Sciences. Somebody had asked in one of the previous town halls what that means. And I will point out that it didn't come with any change in compensation. But it basically means that my role in academic affairs is, I guess, a little bit more solidified in that title, and that's why the provost wanted to make that change. I serve very closely on all of the different academic affairs committees and meetings with her. She has asked me to stand in for her at various times and at various events and traveling to different meetings and that kind of thing. So she wanted to, I guess, further integrate my role within academic affairs with that title. Although my, obviously the greatest part of my scope of work is related to the division. Chris Owens is Associate Vice President for Health Sciences, and his title hasn't changed.
Okay. Rex, we're all caught up on questions, but I would like to ask one if you don't mind.
Sure.
Could you please give us your professional assessment of the COVID-19 situation currently in Southeast Idaho, kind of where we're at, what you're seeing, what your thoughts are as we move forward?
Sure. And I did get a brief update over the weekend. Many of you may be aware that cases in Southeast Idaho have been increasing pretty substantially. Most of those cases, and our cases doubled over the last week, from in the mid-30s to over 70. We may even be over 80 now in our health district in Southeast Idaho. We've been doing a lot of testing at the drive-up testing center, and in fact, last week set records for the number of tests that were done on campus here at ISU. with the number of tests per day. Several of the cases that have turned up positive each day have been through our drive-up testing center. So it's really providing, I think, a very valuable service to the community. The numbers of cases doubling have been related to increased testing, like we just talked about, but also contact tracing. And so the health department is doing a very good job, I think, right now of testing folks that are contacts of positive cases and following up on those very, very diligently, and sometimes with multiple testing over time. The student case that I referred to that occurred last week was was a sibling of a positive case of a young person who's currently admitted to the hospital here. And so that one reason we're seeing increased cases is there's increased testing, but there's also been some travel-related cases that have occurred in Southeast Idaho, and an importation, I guess, if you will, of new cases to Southeast Idaho. There have also been a few cases where no risk factor, meaning travel or close contact with the known positive, has been present, and those are usually termed community spread. And there has been some of that as well in our public health district region. There were numerous cases over the last week and a half or so from Idaho Falls that included some people from Pocatello and Southeast District from a religious revival that occurred where there was one person sick. And it just points out again the high infectivity of this virus, the importance of having people who are ill not interact with others, the utilization of social and physical distancing, and face coverings limiting the spread, because when groups get together and an infected person slips through, particularly a symptomatic infected person slips through, in some cases, because of the rapid and efficient spread of this virus, it can spread very, very easily. And so this is one of the reasons that we're being very, very cautious when we talk about being in person in the fall, to make sure that we have adequate physical distancing of our classrooms, because if someone were to become infected, that close proximity, the lack of face coverings really contributes to the spread. So it'll be interesting to see what happens over the rest of the summer. I was very concerned last week as we saw this uptick in cases in Southeast Idaho, but over the weekend there were just a handful. So it'll be interesting. There seems to be a lull over the weekend because of reporting, tracing, and testing. So it'll be interesting to see if we pick up on that trajectory here Monday, Tuesday, Wednesday of this week again. But the disease is currently in the community. It's quite concerning. The fatality rate in the state of Idaho, because of its propensity for causing real severe illness and detectable illness in the elderly, has remained at about 1 in 35 people infected ends up passing away from this virus based upon the risk factors that are present. I think with all this additional testing and with all of the asymptomatic infections and that kind of thing that are now being detected, that fatality rate will likely come down a bit. But since the beginning of the epidemic, it's been close to a 3% mortality rate in the state of Idaho. And it just has many of us very, very concerned about the continuing and ongoing, and in our case, increasing spread of illness in Southeast Idaho.
Thank you, Rex. How about Idaho's first confirmed case? Apparently somebody from ISU Meridian. Did that person recover well, and are there any other known cases from that contact?
So there was one other case from that known contact. It was a household family member, at least that I'm aware of. My understanding is that those folks have recovered well. There were no other cases at ISU Meridian that were associated with that case, but there was a contact within the household. And that seems to be fairly common, that household contacts are a big part of the spread of COVID-19. There has been, I think, 3 other cases from the Pocatello campus over the course of the last 3 months, and I'm not aware of the spread. I know that the case last week was spread from a person that was again a family member of that individual.
Okay. And are there any specific precautions that we can take here in Pocatello? Or can you tell us where cases are coming from, such as, say, Walmart, without wanting to blame Walmart, however?
So there, and it's been in the paper, there have been a couple of cases at Amy's Kitchen, the food processing plant here. My understanding, talking with the district health department, was that those 2 people did not work together, that it was just sort of, at least based upon the investigation thus far, it was coincidence that they both worked at Amy's Kitchen, and there does not seem to be, at least that I'm aware of, and it's been 3 or 4 days since I've spoken with the health department, that there was extensive spread within that facility. I did hear a rumor that there was a hair salon in Pocatello that had a positive case, and that was confirmed by the health department. I don't know the name, and I'm not gonna, if I did, I probably wouldn't spread it anyway, but they didn't tell me that. So places where you might expect, a lot of mixing of individuals or folks working in close proximity continue to be risk factors. I'm not aware of any, other cases. When I get the reports, they don't give me much detail. They just talk about whether it's community spread, spread from a contact, or travel related, and they give a little bit of the I guess demographic data of the individual, such as gender and age. There has been a broad mix of ages of people infected, and if you look at the coronavirus.idaho.gov website, it'll give you a lot of demographic data, even at the health district level. And you can see that the bulk of the infections, if you look at the total number of infections, have been in young people. Fortunately, the mortality has been virtually non-existent, less than 40 years of age. In fact, I think up until now, there hasn't been a single death in the state of Idaho for anyone less than 40. So that's the good news, but we have seen significant illness and illness in healthcare providers, and more severe illness the older people are who are infected.
Rex, will you be tracking students who participated in recent protests to see if they will be tested? And what are your expectations for when campus reopens as far as cases rising?
So obviously, the George Floyd and the Black Lives Matter protests and demonstrations have brought people together. I have to say that in much of the video and the photographs that I've seen from Pocatello, there were a lot of face coverings being used, which made me feel good. We're not doing any specific tracking of that. I don't believe that the health department would have signed off on that gathering if they'd have been asked. I'm not sure they wanted to get in the middle of the politics there either, and I'm not sure it would have made a difference. It didn't make a difference with the high school finals rodeo, if you've been following that story in Southeast Idaho. The reality is we could see an increase in cases because of these groups coming together and having these kinds of activities. I do think that the first 2 to 4 weeks after school starts will be an important time. There are, and I again talked with the health department about this, and I'm sorry I'm running up against our time here, but I did talk with the health department about this, and they're going to make additional testing available later in the summer, where we'll have an increased capacity, and we're looking at ways of potentially utilizing that in an effective way to screen people coming back to campus and being able to better manage the potential rise in infection as we get large groups coming back to campus and coming from areas where there's potential high disease prevalence occurring. So We are doing some planning around how to best utilize testing as we get people back together. We're not doing any specific testing right now, although there is some screening, for example, of student athletes who are coming back to campus to work out and to get with their teams and do that kind of thing. There is some stuff happening there.
Okay, Rex, I'm going to take one more question since we are bumped up against the hour. The last two that I'm going to miss, I'll take offline and get those answers from you and send them directly to the askers. So this question, I think it pertains to everybody in the room. Does this increase in cases play into the changes in when we were planning to come back to campus for summer? I know originally we were looking at the week
I
of...
just threw it in there.
Sorry.
Do you have another one?
I know originally we were looking at the week of June 15th, but have since been told to stay home if we are working from until there is more information.
So it's perfectly reasonable for people to begin thinking about coming back to work after June 15th during stage 4, at least given our current guidance that we should be planning to be able to do some of that. Not everyone needs to be back at their desk and back at work during that week, particularly those who are part of vulnerable populations, for example, and can't have adequate distancing and other disease mitigation efforts. So work with your supervisor in those specific situations. But I think moving after June 15th, we will be moving back towards a new normal. That being said, if we continue to see an increase in cases, especially a dramatic increase in cases in the state, we may not meet the metrics to move from one stage to the next. And so it'll be interesting to see if that were to occur, what ends up happening in terms of the governor's public health recommendations, because it runs up against the economic and political and other implications of COVID. So I will say from an ISU perspective, we're going to follow the statewide guidance as it's currently laid out. If we start seeing regional differences that are dramatic, I think there may be a time coming where we will see not a statewide plan, but a more regional plan related to the disease activity in individual areas. And that hasn't been formalized if we're going to see that yet. And really, we don't know what happens in stage 5, right? That is, what happens and what are the recommendations from public health after stage 4, which is June 13 to 26. What is the new normal? My guess is that we will still have some of those 6 basic disease mitigation activities related to physical distancing, face coverings, and those kinds of things, even moving forward at a statewide level. And obviously, that's what we're planning for here at the university. But after June 15th, it is okay for people to begin coming back to work in a coordinated, planned way within your academic or administrative unit. That should be discussed and approved.
Great, thanks, Rex. I'll turn it back over to you and I'll send you these final questions offline.
Okay. Well, thanks everybody for being here. I really do appreciate all of the attendance at these town halls, and in between town halls, if there are questions that come up, you absolutely can email me. You can email the divisional office and we can try to get your questions answered. It's a very dynamic and rapidly changing situation. I know there's a lot of uncertainty related to what we're doing and when we're doing it and how we're doing it. And we're just trying to keep you all informed, and we'll be having more of these town hall meetings so that we can discuss these questions as we move forward. So I appreciate you all being here, and I appreciate all you do within your academic and administrative units. And I know it's a difficult time. It's difficult not working and seeing our colleagues regularly, but hopefully we'll get back to where we can at least do that with some distancing and some face coverings here in the not too distant future. Have a good day, everybody.